Hello, I am Shivam Damani from Mayo Clinic, and I'm happy to share our work on the design of a novel phonoenterogram sensing device using AI-assisted computer-aided auscultation at the Design of Medical Devices conference. To set the stage, I want to highlight how pain costs the US healthcare system approximately $300 billion a year. The diagnosis of IBS requires several invasive and non-invasive investigations like endoscopy, colonoscopy, abdominal imaging, etc. The lack of a definitive diagnosis in IBS, despite several investigations, lead to patient dissatisfaction and mental strain. There is an unmet clinical need for a novel, cost-effective, non-invasive test to aid in their diagnoses. IBS is also the fourth leading cause of abdominal pain, costing the US healthcare system approximately $10 billion a year, and it is associated with altered bowel motility. Talking a little bit about the phonoenterogram, it is a recording of the sounds from the bowel, which can potentially be used to diagnose and monitor gastrointestinal pathologies. There are no existing devices for high-fidelity recording of bowel sounds to enable AI-assisted computer-aided auscultation to impact clinical practice. Our study proposes a medical device to record these sounds and develop a deep learning model to classify prominent and obscure bowel sounds that can assist with the design and development of a novel PEG sensing device to enhance the GI digital practice. Talking a little bit about the proposed device, here are some statistics about how large the market is for GIH diagnostic devices. I want to especially highlight that the US GIH diagnostic devices market is estimated to be about $3.7 billion by 2025. Our proposed device can capitalize on this opportunity in this space since there is no device on the market for continuous long-term phonoenterogram monitoring. Here is our proposed design of our device. It would be able to record the data from multiple points and multiple forms such as the ECG, the PCG, and the PEG. Together, these would be able to completely fingerprint the intestines. Once the data is recorded, it would be able to transfer it to a smartphone device using Bluetooth. Diving a little bit deeper into our study, we defined two types of bowel sounds, obscure and prominent. Obscure bowel sounds are present throughout the recording, but are only audible to the human ear upon amplification, whereas prominent are loud and are audible without. Amplification was performed to all the files such that our annotators were able to accurately recognize the start and end of bowel sounds. Talking a little bit about the methods, we used an echo duo stethoscope on 10 subjects and recorded 121 files of which each were length 2 minutes. We recorded at the left upper quadrant and the right lower quadrant, and we extracted a PEG and corresponding ECG and used the Label Studio software to annotate them for training with our deep learning model. We had 3 types of recordings with respect to meals, and another 24-hour recording, which was to understand the physiological changes during sleep and after defecation. Here on the left are some examples of the prominent versus obscure bowel sounds, and on the right are their corresponding spectrograms, which were extracted to train our deep learning model. And to summarize our results, we had a total of 11,000 data points, which were split into test, validation, and training. And as you can see on the bottom right, our area under the curve for this model was 0.89, which shows that our model was performed reasonably well in classifying prominent versus obscure bowel sounds. Some limitations of our study include that we recorded at one location only, and we don't have a device that was able to record at both simultaneously. And since our stethoscope was a little bulky, it often recorded artifacts, and Bluetooth connectivity was also an issue sometimes. Thank you.